Okay, so here we have the website, and we will go ahead and usually when you come to the website, it's babyoralhealthprogram.org. I always click for parents. So this just gives you all the general information you need to know as your child is developing and taking the proper care step by step of the way. So we'll go ahead and start with 0 to 6 months. This is a critical time because about 6 months, your child's teeth are going to slowly start to erupt. You'll probably notice their first teeth coming in about 6 to 8 months. The bottom front teeth are usually first, and then it goes with the top two front teeth. Now, when this is happening, you may notice your child being a little more fussy. They may be, chewing on things. You just want to make sure you're steer clear of products like baby oral gel because it can, cause other problems. Just get a safe teething toy that your child can chew on. This will help. This will help with any of that. It's got your general oral health information, and then social and emotional growth. So I like to look up here, mouth cleaning. So this is what we want to focus on. So at 0 to 6 months, you want to begin to use a moist washcloth. This is to wipe your baby's gums after feeding. You want to make sure you're looking at their gums regularly because this is important too. You want to make sure their gums are healthy. If you see anything strange, make sure you consult with your dentist. Now, you want to begin brushing your child's teeth as soon as they come in. Brushing twice a day of soft toothbrush, and then use just a small amount of fluoride toothpaste in just a circular motion. The size should be literally no bigger than the size of a grain of rice, as you can see in this picture here. Set a good example of your child by taking care of your own teeth and gums. So this is very important to begin a habit. Now, at such a young age, your child is always copying, what you're doing, what the people around them are doing. They do what they see. So if they see you consistently, having a good habit with your oral health, they will want to do the same and copy and do the same. Also, the younger that you get them into a process of a habit, the more likely it is for them to stick with it, for them to continue it, and that's very important. So just setting a good example. Some things to watch for. So thrush, this is any white looking spots in your baby's mouth, kind of like a cottage cheese. This could be like a bacterial infection or fungal infection. So you want to make sure you're looking for that. Consult a dentist again if you see anything, maybe some bumps on the gum. Yep, just little things you want to watch out for just so it doesn't cause any problems with our developing teeth. So at 6 to 12 months, your child should be getting their 4 front teeth in, and then slowly starting to get other ones. Now, diet is going to be huge, especially once the teeth start developing. You want to make sure you are taking care of your baby's teeth, that way to prevent any cavities. So big one that we couldn't stress enough is avoid putting your child to bed with a bottle. If you put your child to bed with a bottle, only use water, strictly water. Some people don't know this because, you give your baby milk or you give them juice just to go to bed. Well, that juice especially has a lot of sugar in it. And if your baby is going to bed with that bottle, that acid in the juice, the sugar is going to be causing an attack on your child's teeth. It's going to start to break down your child's teeth, especially if it's a habit to put your child to bed with a bottle. And this could be a big factor in causing cavities. And, in children, cavities spread like wildfire. So you just want to make sure you are watching, this detail, just protecting your child altogether. This is why we couldn't stress enough how important it is to brush your child's teeth with fluoride toothpaste. especially as soon as they start erupting, because this fluoride is going to put the minerals into the teeth to help strengthen them and protect them. Now, brushing. Again, like we said, as soon as they come in, twice a day, soft bristles. Your child should start to see a dentist regularly by the age of 1. Usually as soon as their teeth start to erupt, you want to make sure you're starting to get them in. That way we can get them going on continuous maintenance care, watching anything, making sure nothing progresses, because we don't want that to happen. We want to make sure your child has a healthy, your baby teeth are very important. Some people don't realize that they are as important. We know you lose them, but things could go wrong. Like if you lose your child's teeth early on to cavities, it could actually mess up eruption patterns or spacing when your child's permanent teeth come in. So we just want to make sure we are taking care of that. Maybe even protecting your child's teeth, sealing them, or if they do have a cavity, getting some work done, some fillings, just to make sure, you don't lose the whole tooth and it's not spreading in the mouth. Again, at this age, things to watch for: your child's teeth are erupting, so eruption patterns. If it's completely out of order, you want to keep an eye on this. Eruption cysts. Now, this is really common sometimes when your child is developing teeth. They get this soft fluid-filled swelling over the tooth, bluish. You just want to keep an eye on that. It could cause them some discomfort. Most of the time, after your tooth erupts, this goes away. Enamel defects is a huge one. This could be due to genetics or systemic fluoride exposure before eruption. So you just want to kind of watch for any yellow, brown, or white spots. Consult with your dentist just to catch anything, that way we can start taking care of it before it develops into anything else. And cavities, again, we couldn't stress enough about cavities. It's important getting them treated, determining, the best options for that. At 12 to 24 months, most of your child's baby teeth come in around this time. The last teeth are going to be their second molars, which is around could be delayed. Okay, so again, avoid using any oral gels, teething products, as they may be unsafe. Diet, again, no juice, no milk in the bottle during bed, only water. And this, you should not give your child juice until after their first birthday, unless a doctor tells you otherwise. Between ages 1 to 6 years, children should only be drinking about half a cup to 1 juice box per day. Again, juice has a lot of sugar in it, and this could be an underlying issue, causing cavities. If you do give them juice, we definitely recommend that you dilute it with water. Also, a huge thing that we recommend is that if your child is having any sugary beverages or snacks, this is why fluoride is so important, because you want to make sure you are strengthening those teeth. But also, maybe after having that sugary drink or snack, giving your child like a water rinse. That way you can rinse that sugar off. That way the acid is not sitting on there attacking the teeth. Your child is too young for mouth rinse at this age, so just making sure you're using your fluoride toothpaste. Make sure they are getting only about 16 ounces of milk per day. Limit any high sugar snacks. Now for brushing, again, same thing, grain or rice, twice a day. And the whole reason we say not too much toothpaste is because as your child isn't really that good at knowing to spit all the toothpaste out. They could be swallowing it, And the fluoride can actually cause, maybe it can result in your child getting an upset stomach. You can have a, toxic amount, and your child, could react to that. So you don't want them swallowing it. So you just want to make sure you're using the tiniest bit amount. That way, you can prevent that from happening. Some things to watch for at this age. Again, cavity's huge. We want to make sure we take care of those. Any bleeding gums. This could be a sign of gingivitis, which is periodontal disease. This could be because your child's not removing the bacteria and plaque from their teeth around the gum line. If you are taking care of this, it should stop between 7 to 10 days. So keep an eye on this. Now, for 24 to 36 months, this is where you can start using, once your child is able to spit very well, then you can start using a pea-sized amount of toothpaste. This skill usually develops between 3 years to 6 years of age. Also, when we talk about flossing, as soon as your child's teeth start to touch and there's no spacing, you want to begin flossing. Interproximal decay is, very common amongst many people, and a toothbrush cannot access these areas as good as floss can. This can also help strengthen your child's gums, reduce any bleeding, and again, like I said, getting in the habit of something is just very important. Being a good role model, because your child, monkey see, monkey do. They copy what they see. They see you having good habits, having good oral hygiene. They're going to want to copy and do the same. They're just going to grow up thinking that it is a part of normal daily life. This is good because the younger they start a habit, the more they'll continue it throughout their lifetime. And this is very good, protecting their teeth. A lot of people, think that primary teeth aren't as important because they fall out anyways, and then you get your permanent set. But I can't stress enough how important your baby teeth are. And, your baby teeth being taken care of is definitely going to affect how your adult teeth are when they come in. So, this website is a very good resource if you have any information. It tells you a lot that you need to know, things to look out for. Again, it talks about the diet and what to watch out for. So maybe just getting into that regular routine also as soon as they start to develop. By year 1, by the time they're 1 year old, they need to start to regularly see a dentist. That way we can keep an eye in development and, have a good, healthy oral health throughout their lifetime. So if you have any questions, just let me know. Yeah, thank you.